Hi, I'm Dr. Claudia Velozzi with the CDC Immunization Safety Office. Today, I'll provide answers to common questions people have regarding the safety of influenza or flu vaccines. I will begin with the question, are flu vaccines safe? Over the years, hundreds of millions of people in the United States have safely received seasonal flu vaccines. Every year, CDC works closely with the Food and Drug Administration, or the FDA, to ensure the highest safety standards for flu vaccines. For flu vaccines to be approved for use in the United States, manufacturers must meet strict standards to make sure they are free of contaminants and the potency is appropriate. Once the flu vaccines are approved for use, CDC and FDA ensure systems are in place to promptly detect and investigate possible health problems following vaccination. The next question is, who should get the flu vaccines? Flu vaccines are recommended each year for everyone who is 6 months of age and older. People with severe life-threatening egg allergies should consult a medical professional before being vaccinated. Next, what side effects can occur from a flu vaccination? The most common reaction to the injected flu shot is soreness around the injection site. Other mild problems may include redness or swelling where the shot was given, and occasionally fever and body aches. If these problems occur, they usually begin soon after receiving the shot, may last for 1 to 2 days, and resolve on their own. Common side effects from the nasal spray flu vaccine include runny nose, headache, and sore throat. Life-threatening allergic reactions to flu vaccines are very rare. If they do occur, it is within a few minutes to a few hours after vaccination, and effective treatments are available. Signs of a serious allergic reaction to vaccination can include difficulty breathing, hoarseness, wheezing, paleness, weakness, a fast heartbeat, or dizziness. Syncope or fainting following vaccination can also occur. Vaccine providers should strongly consider observing patients for 15 minutes after they are vaccinated. If syncope develops, patients should be observed until the symptoms resolve. Another common question is the flu vaccine safe if I'm pregnant? Well, the answer is yes. Flu shots are safe for pregnant women and their unborn babies. Millions of pregnant women have received the flu shot over many years. Getting a flu shot protects both pregnant women and their unborn babies from birth up to 6 months of age from flu and related complications. The nasal spray vaccine is not recommended for pregnant women. The flu shot can be given at any time during pregnancy, and it is safe for women who are breastfeeding or who plan to breastfeed their child. Breastfeeding mothers that have been vaccinated can pass the protective antibodies through the breast milk to the infant, which can then reduce the infant's chance of getting sick with the flu. This is especially important for infants less than 6 months old who have no other way of receiving protective antibodies since they are too young to be vaccinated. The next 2 questions deal with the safety of the vaccine ingredient thimerosal. The first question is, what is thimerosal and why is it used in some flu vaccines? Thimerosal is a very effective ethyl mercury-containing preservative that has been used for more than 70 years to prevent contamination, such as the growth of bacteria or fungi, in some types of vaccines where multiple doses are drawn from a single vial. Thimerosal is, in fact, an important ingredient contributing to the safety of multi-dose vials of vaccine. Flu vaccines that are packaged in multi-dose vials do contain thimerosal as a preservative. Other types of flu vaccines that come packaged in individual syringes or as individual units do not contain thimerosal. Additionally, the nasal spray and high-dose injectable flu vaccines do not contain thimerosal. So the next question is, should I be concerned about flu vaccines that contain thimerosal? There is a large amount of scientific evidence on the safety of thimerosal in vaccines. Data from several studies show the low doses of thimerosal in vaccines do not cause harm and are only associated with minor reactions, like redness and swelling at the injection site. Furthermore, many well-conducted scientific studies have shown no association between thimerosal in vaccines and autism or neurologic problems in children. We do recognize that parents may still be worried about thimerosal in flu vaccines, and there are thimerosal-free flu vaccines available as an option, both for the injectable and nasal spray types of flu vaccine. Another concern about the safety of flu vaccines involves Guillain-Barré syndrome, or GBS. A common question is, does the flu vaccine cause GBS? GBS is a relatively rare neurological disorder that causes muscle weakness and sometimes paralysis. In the United States, an estimated 3,000 to 6,000 people develop GBS each year on average, or about 80 to 160 cases each week, whether or not they have received a vaccination. Anyone can develop GBS. However, it is more common among older adults, especially those ages 50 and older. Many health conditions have been associated with GBS. About 2/3 of people who develop GBS symptoms do so several days or weeks after they have been sick with diarrhea or a respiratory illness. Infection with the bacterium Campylobacter jejuni, a common cause of food poisoning, is one of the most common risk factors for GBS. People can also develop GBS after having the flu or other infections, such as cytomegalovirus or Epstein-Barr virus. And sometimes GBS develops following surgery. On very rare occasions, people may develop GBS in the days or weeks after getting a flu vaccination. There are some data that suggest flu vaccination may result in a small increased risk for developing GBS. This increased risk is on the order of 1 to 2 additional cases of GBS per million persons vaccinated. This risk needs to be placed in the context of the known benefits of flu vaccination in preventing flu illness. Finally, you may ask, do flu vaccines cause febrile seizures in children? Febrile seizures can be frightening for a child's caregiver and parents, but nearly all children who have a febrile seizure recover quickly and are healthy afterwards. Febrile seizures can happen with any condition that causes a fever, including common childhood illnesses like the cold, flu, ear infection, or roseola. Since vaccinations may be associated with fever, febrile seizures can also happen following vaccination, although rarely. In general, most febrile seizures occur in children between the ages of 6 months and 5 years, and this age group is recommended to receive flu vaccine annually. CDC studied the healthcare visit records of more than 200,000 children 6 months through 4 years of age who received flu vaccine. The analyses found that febrile seizures following the flu shot in this age group did occur, but were rare. The febrile seizures were most common in children ages 12 to 23 months when the influenza shot and another vaccine, the 13-valent pneumococcal conjugate vaccine, or PCV13, were given together during the same healthcare visit. In this group, about 1 additional febrile seizure occurred among every 2,000 to 3,000 children vaccinated. After thoroughly evaluating this information and assessing this in the context of the benefits of both flu vaccination and PCV13 vaccination, CDC determined that no changes in the childhood immunization schedule were necessary. In summary, CDC places a high priority on vaccine safety surveillance and research. CDC and FDA continuously monitor the safety of vaccines recommended for children and adults in the United States. Flu vaccines have been used for decades and have an excellent safety record. This concludes the CDC video on answers to common questions about flu vaccine safety. Thank you for watching. For more information on flu vaccine safety, please visit the CDC flu vaccine safety page provided here. And for more information related to flu and the flu vaccine, please visit the CDC flu webpage at www.cdc.gov/flu.